Good afternoon, everyone, and thank you for joining our webinar. Today's webinar is Cutting Through the Competition, How Practice Management System Vendors Can Demonstrate a Higher Standard of Quality, Privacy, and Security. We have an outstanding collection of talent today, so bear with me as I review the panelists' bios. I'll try to run through these relatively quickly, but they have some great credentials I want to get through. Lee Barrett is the Executive Director for EHNAC, the Electronic Healthcare Network Accreditation Commission. Mr. Barrett has 10 years leading healthcare professional service organizations as well as 20 years in senior management roles in payer organizations. He speaks nationally on a variety of healthcare industry topics and is involved in a number of industry coalitions promoting the use and implementation of health IT, including both administrative and clinical transactions, as well as the development and proliferation of EHR systems, meaningful use across National Health Information Network and HIEs. Dr. Devin Jopp is President and Chief Executive Officer for the Workgroup of Electronic Data Interchange, a national nonprofit whose members represent a cross-section of the American healthcare system. WEDI is dedicated to enhancing the exchange of healthcare information in order to increase efficiency, improve quality, and reduce costs, and serves as an advisor to the Secretary of Health and Human Services, as named under the 1996 HIPAA law. Prior to coming to WEDI, Dr. Jopp was Chief Operating Officer at SCORE, Chief Administrative Officer at URAC, and held several C-level roles at Health Insurance Association of America. Tim McMullen has been in association management for over 15 years. He was recently hired to lead the new Association for the Practice Management Systems Industry, the Healthcare Administrative Technology Association. He also serves as Executive Director of the Cooperative Exchange, the nation's leading association for healthcare transaction clearinghouses. Mr. McMullen is a certified association executive and has a law degree from the District of Columbia School of Law with an emphasis on public interest law. He served as community liaison for the D.C. Council member and worked for a boutique D.C. lobbying firm. Mr. McMullen has a bachelor's degree in television and film management and was going to be a famous Hollywood producer, but the nonprofit world called him away from Tinseltown. Stanley Nachimson is founder of Nachimson Associates and former CMS lead on HIPAA and regulatory development and implementation. He's an expert in HIT landscape, providing independent leadership to the industry on a variety of topics, including ICD-10 implementation, new HIPAA transaction standards, EHR development, implementation, and industry collaboration among plans, providers, clearinghouses. Mr. Nachimson leads ICD-10 workgroups for WEDI and HIMSS and provides guidance to a number of industry organizations and companies. Robert Tennant, Senior Policy Advisor, Government Affairs for the Medical Group Management Association. He focuses on federal legislative and regulatory health information technology issues, including HIPAA, electronic health records, electronic prescribing, and ICD-10. Mr. Tennant began his work with MGMA in June 1997, received his undergraduate degree from Carleton University and his master's degree from the University of Western Ontario, Canada. Mr. Tennant also attended the University of Maryland, College Park for doctoral studies. He's also received the WEDI Distinguished Service Award and Leadership in Technology Award. Anna Croxton is Vice President, Electronic Data Interchange, Products and Services for NextGen Healthcare and Vice President of HATA. Ms. Croxton has more than 25 years of healthcare and industry experience and is currently responsible for managing regulatory changes that have potential financial impact. In her distinguished career, Ms. Croxton successfully managed the original HIPAA adoption of ANSI, the adoption of standard NPI and 5010. Ron Moser is consultant and senior site reviewer for EHNAC. He provides leadership in the development of new programs and has a detailed knowledge of each of the programs. Mr. Moser performs audits for EHNAC and provides leadership and training for site reviewers. He's also managing director of Moser House Consulting, which provides guidance to healthcare IT organizations that want to improve their operations through the implementation of effective risk-based IT controls. Mr. Moser maintains CISA and CRISC certifications and has a Bachelor of Science degree in Computer Science from Taylor University. And with that, I'll turn it over to our host today, Lee Barrett, to continue on with the presentation.
Thank you, Dave, and welcome everybody. And as Dave has gone through the bios and introductions of all of our panelists, we really have a terrific, hopefully, program for you this afternoon to really talk about really what we're doing, what we've been doing with the development of this practice management system accreditation program between EHNAC and WEDI and the partnership that we've formed there. So let's go to the next slide, Dave, and I'll take you through some of the objectives that we have for the webinar today. So first of all, what we're going to go through is really an overview of the timeline, the process, what's incorporated as far as the criteria in this practice management system accreditation program. We're also going to provide an overview of the value proposal to the practice management system vendors as well as the providers of the accreditation. And we've had a number of organizations, Rob Tennant from MGMA, and we've had other industry associations from the provider community involved with the development of the program. So I think as Rob starts to talk through and give you some of the points that they're seeing, I think it will certainly help to put in perspective the value prop that we saw certainly for the providers as well as for the vendors and other stakeholders as well. We're also going to be talking about, is there really a sense of urgency here to become accredited and why? So we'll be talking through, and I think you'll hear from a number of the panelists their specific perspective on the sense of urgency and the value proposition to each of the stakeholders. We'll talk through some of the aspects as well of the accreditation program, and Ron Moser will be talking through all the various aspects and major categories that were covered. And why as a practice management vendor should you apply, and what do you need to do to apply? Next slide, Dave. Additionally, we'll talk through some of the examples of the value proposition as well as the competitive advantage for the practice management organizations. And you'll hear from Anna Croxton from NextGen, who's been one of our beta organizations. We've had three organizations that have participated as betas. So we've gotten some very good feedback from them as well, which we've factored into the development of the overall program. And finally, what we're going to talk about as far as the objectives here is, what do you need to do? If, based upon the value proposition, what do you need to do as a practice management system vendor to actually go through and to prepare your organization to seek the accreditation? Next slide, please, Dave. We see a number of challenges, certainly as we put together and developed this program over the past 5 to 6 months. And so what we're really focused on as far as the challenges here is really working with the practice management system vendors to understand the sense of urgency and the value proposal to your organizations to go through and seek the accreditation. We're also very focused from the provider side as a major stakeholder here, utilizing practice management systems to manage their entire practices and what the value proposal as well is to them, and why, as providers, any providers that are on the webinar, listening to the webinar, why you want to be going out and asking your practice management system vendor why and why they're going through, why they need to go through accreditation, and how important it is to you as an organization to have that trust that the practice management system vendor has all the capabilities that you're looking for to support your practice. We talked about kind of the stakeholder trust and the fact that there are a number of stakeholders that are affected here and that we're trying to focus on as part of this program. And the fact that privacy, security, confidentiality is a major component of this program. And again, what we're trying to do is to mitigate the potential for a breach or an incident in any of the practices by assuring that the practice management system vendors have all of those controls, the policies, and the procedures in place in an effort to mitigate the risk of, as I said, a breach or an incident actually occurring. So that's what we're really all about. That's what this webinar is going to go through, and you're going to hear the various perspectives from each of the panelists here. The way we're going to do this is each of the panelists will be going through and providing some of their perspectives. We'll then go into a Q&A process with the panel, and I have a number of questions for them. We'll then open it up to all of you as an audience to submit questions, and I will be fielding those questions and directing them to either the specific panelist or to the panel themselves. So there'll be plenty of time, and we're allocating plenty of time here for your questions, because this is really about giving you as much of a perspective on what this program is, why you need to understand it, and what organizations need to do to move forward if as a practice management system vendor to apply and to gain that level of accreditation. All right, next slide, Dave. So Devin, I'm going to turn it over to you. And so Devin, as I've indicated, Devin Jopp from WEDI, along with EHNAC, partnered to develop this program. And I wanted Devin, from a WEDI perspective, to talk about kind of the value prop and as well their perspective on why it was important for them to partner with us and to develop this program. So let me turn it over to you, Devin.
Oh, thank you, Lee, so much, and I apologize if I'm running through a little bit of a cold here. But I think the WEDI factor is actually a good title for this section, because what we really view ourselves in this is really a catalyst for industry action. And the practice management vendors really play a critical role in our industry, and I think often understated. As you know, they all impact the productivity of our physicians' offices. They are oftentimes the front door, if you will, out in the world of information exchange. And they also serve as the basis for future innovation. How do we actually make sure that the systems support not only where we are today, but where we're going? And so I think looking at this, we looked at the practice management system vendors as an area that really could use some assistance looking at how do we really bring some common levels of functionality and understanding around how the systems actually operate and perform. And how do we know that there's trust that these organizations and their systems actually are meeting those baseline of criteria set. So that's kind of how we got into this. A number of our organizations that are members actually raised this issue. And so we ended up taking action and partnering with EHNAC to get behind it. And I think you should take it as the fact that we see this as a very high industry priority, that practice management system and vendor accreditation is something that can really help, I think, move our whole industry forward as we look ahead towards not only implementing what we have to do right now, such as things like ICD-10 or basic privacy and security, but as we look ahead again for things that we may not even be able to anticipate today. So obviously, I think we're very supportive of this. We're very excited to see the criteria set out in the draft, and very grateful to our beta partners for taking the risk in the leadership in the industry in order to help move this forward. So with that, I think my part is very short. We look forward to continuing to support this program and its rollout, particularly as we end out the year here. And I'll go ahead and turn it over to the next speaker, Lee. So thank you.
All right, thanks, Devin. So next is Tim McMullen, and Tim is going to be talking to you about the Healthcare Administrative Technology Association, or HATA, and HATA's involvement in representing the practice management system vendors. And Tim has been very actively involved, along with a number of the members of HATA, in the development of the program. So Tim, I'll turn it over to you.
Well, thank you, Lee. The Healthcare Administrative Technology Association supports the PMSAP, as we believe it produces a great benchmark for the practice management system community. Next. Next slide. Great. Well, who the heck is the Healthcare Administrative Technology Association, which is also known as HATA? Well, we are the nationally recognized association for the practice management system industry. We provide our members important and timely information about the healthcare industry. We offer ways for healthcare administrative technology companies to expand their client base. We offer many opportunities to interact with your peers. We have a broad membership base, not only of practice management systems, but of payers, providers, clearinghouses, other vendors. So it's a great way to involve all the stakeholders in the healthcare community, especially in this very important key piece of the industry. We're the voice of the industry, be it Congress, regulatory bodies, standards organization. We let them know what's important to the healthcare administrative technology industry. And finally, we not only educate those other stakeholders, but we influence them as well. Next slide. One of the many ways that we were able to contribute as a voice to the industry was to become involved in the PMS accreditation program right from the very start. HATA sits on the advisory committee who approves the final criteria. We've been involved in laying out the criteria, making sure it speaks to what PMS vendors actually do and what they should be accredited on. This was done by HATA members looking at the criteria on a weekly basis and making recommendations to EHNAC. And finally, as Lee said, two of the HATA members are involved as the beta testers and adding their experience to the process. Next. So what's in it for me? What is the ROI for practice management system vendors? Well, EHNAC is actively marketing this accreditation program to the provider community. It's going to be used as the marketing differentiator, the seal of approval, if you will. It's a large part of the accreditation program involves your handling of patient health information, or PHI. So you'll be able to show your potential clients you're handling their PHI according to HIPAA regulations. And with payers, you'll be able to pull out your application and show them all in one place that you have the policies and procedures they require. It's all going to be right there in the application, easy to show. And finally, you'll be able to show that, and as I mentioned before, this will begin to be used by providers, and you'll see the requirement start showing up in RFIs. And during the application process, it also gives you an opportunity to do your own internal audit. And finally, accredited PMS systems will be able to say that they are ICD-10 ready based on 2 criteria that require the candidate to process claims in both 9 and 10, and requires implementation plans to be shared with clients at all stages. So the PMSAP is something every healthcare administrative technology will want to have. And more information can be found on the HATA website at hata-assn.org. Thanks, Lee. Back to you.
Thanks, Tim. Good perspective on HATA and the involvement, and we've really appreciated HATA's involvement in the development of the overall program. So next we're going to hear from Stanley Nachimson. And Stanley, many of you are familiar. Stanley's done a number of and been involved in the industry for many years in speaking. And so Stanley's been involved as well in the development of this overall program, and he's going to be talking about what was the actual problem here that we were trying to solve with the various stakeholders. So I think he brings, with his background as well at CMS, plus his perspective as a consultant in the industry today, he brings really a unique perspective to the development of this program. So Stanley, let me turn this over to you.
Thank you very much, Lee. I'm certainly very excited to see that a program such as PMSAP has come into fruition. So if we can turn to the next slide. Since the beginning of HIPAA implementation, we have had a problem in the relationships among providers and vendors in health plans. Now, providers, in many cases, especially in the small provider side, they are not familiar with the technical aspects of electronic data interchange, standard transactions, and code sets. And we don't expect individual providers, doctors, nurses, and such to necessarily understand what an X12 transaction is, or how the ICD-10 code set gets developed. We do expect them to understand how the code sets are used, but they do not have to be familiar with how their particular systems use the code set. They want to be able to understand that when they use the system, they're using it correctly, and the results and the output from that system help support their business. In general, providers have depended on vendors to both educate them as to the types of standards and the need for electronic data interchange, and frankly, deliver the necessary software to effectively use that. So a provider doesn't get separate education. They look to the vendors to give them the tools they really need to move forward. However, vendors, being business folks, often depend on their customer and provider demand to drive software development. Now we have sort of a chicken and egg situation here where providers are expecting vendors to tell them what they really need, but the vendors are often expecting the providers to say, what is it that you really need? So there's a gap that has cropped up between providers and vendors. Next slide. From the beginning of HIPAA, vendors were not covered entities. Software vendors were not bound by the HIPAA transaction standards. They did not have to have their products meet the standards. They were not legally required to have all of the standard transactions, or in fact any of the standard transactions as part of their software. And they were not bound by compliance dates. Those of you that are familiar with HIPAA understand that a provider and a health plan, a clearinghouse, as covered entities must use the standard transactions and must implement any changes and new standard transactions by the regulatory compliance date. But vendors, at least under the regulations, were not bound by that. So they depended on, again, their customers to tell them when they wanted the particular changes in software that were necessary to support new or changed standard transactions. But again, as we think about the prior slide, providers did not necessarily have all the information that they needed to direct the vendors as to the content, the functionality, and the dates. This goes back to the providers relying essentially on the vendors to give them the tools that the providers needed to meet the regulatory requirements. Next. So we've got a provider, especially the smaller providers, they did not know if their software, when it was delivered, met all of the standard requirements. Vendors did not necessarily know. They tried to keep up as best as they could, but they didn't necessarily know what all of their customers really wanted and the date and functionality that they particularly needed for each set of HIPAA changes. Vendor delivery schedules were certainly uneven, and being bound by regulatory dates instead of pure project planning dates, vendors may not have had enough development time to really produce a quality product that met all of the requirements, and providers might not have had enough installation and testing time. Again, this was not necessarily the fault of the provider or the vendor, but the fact that providers were bound by the HIPAA regulations and compliance dates on those may not have matched all of the development and testing time. I think we've seen some of the results of that in the delays that have occurred in many of the HIPAA implementations. So we had finger pointing back and forth. The providers would say, well, we're relying on our vendors, and our vendor was late, so why would you think that we could meet all of the requirements? And the vendors would say, well, I mean, we knew what needed to get done, but the providers really didn't understand all of the requirements, and therefore we did not have the demand to have our products installed by a particular date. We had a lot of people blaming each other instead of trying to find a solution to meeting the regulatory required date and functionality. Next step, please. So we're going to turn it over to our next speaker, but I think you'll see that with an accreditation program that allows vendors to understand all the necessary requirements to serve providers and to serve provider needs. With that, providers will be well served and understand when they purchase a piece of software that has been accredited under PMSAP they will be getting the functionality and the quality that they need to effectively meet all of the requirements that they have for their business. Thanks, and back to you, Lee.
All right, thanks, Stanley. Great overview of, I think, the specific issues and the problems that we're trying to address here. So the next speaker, which leads in really well to Rob Tennant from MGMA, and we've very much appreciated MGMA's as well as some of the other provider industry groups who've been involved in the development of the program and their perspective here in assuring that the providers are represented all the way through this program. And so Rob is going to be talking about really kind of the overall value proposal that we're seeing to the provider community. And I think as he'll go through, having the industry groups representing the providers here and assuring that the criteria does meet it was absolutely a critical component of development of the program. So Rob, we'll turn it over to you to kind of give us the overview of the provider value proposal.
Thank you, Lee, and thank you very much for the invitation to participate on today's program. Next slide. We've actually really been very, very pleased to work with the other folks on this program and with others in the industry to make this program move forward. Very briefly about MGMA, we represent as a trade association professional administrators, leaders of medical groups. Since 1926, we have more than about 33,000 administrators and executives in our national and state affiliates. Next slide. But what I really wanted to talk about is sort of the progression of what providers want and need in their organizations. They obviously want to use and leverage technology. They want to automate the revenue cycle management process, but it's very difficult and very expensive. So we're continually looking for relatively simple processes and technologies, and we want standardized approaches to administrative transactions. One of the true challenges facing practices is dealing with the myriad of approaches that different health plans take for their transactions. We obviously don't want to have additional burdens, and for those providers on the program now, you know the burdens that you face on a day-to-day basis with your IT infrastructure, your administrative tasks, all associated with programs and initiatives and commercial health plan mandates. And at the end of the day, what providers want is they want to make an investment, but they want to know that they will get a return on that investment. Next slide, please. So why have we struggled to achieve administrative simplification? And I have here a somewhat outdated figure, but it is staggering that physicians on average spend almost $70,000 per year interacting with health plans, and I can assure you that number is much higher now. And as Stanley alluded to, each stakeholder group seemed to blame the other for why we couldn't move ahead with true administrative simplification. Providers didn't want to interact with their multiple health plans using a proprietary solution. Payers didn't want to offer a solution that only a small number of providers would adopt. And of course, with no single approach, there was a very limited market for practice management system vendors in the space, so nothing really got done. I think a lot of that changed dramatically with the passage of first HIPAA and then recently with the Affordable Care Act, which includes a real sort of a laundry list of opportunities to simplify the revenue cycle for providers. But, and it's a big but, we cannot take advantage as providers of these new standards and operating rules without having the appropriate practice management technology in the organization. Next slide, please. So obviously, we've been promoting the idea of accreditation or certification for a long time. We tried to move forward with this on our own with a PM selection toolkit and directory that we developed jointly with the American Medical Association. But this was limited self-reported information by the vendor. I think it was helpful, but it didn't really get us where we wanted to be. We understand that a lot of practices in the last few years and going forward are looking to update or replace their software really to take advantage of the new HIPAA and ACA standards. At the same time, meet federal mandates, as we'll talk about. ICD-10 is one of them. There's a huge financial risk for practices trying to make a selection of what practice management vendor to go with. There are literally hundreds of these vendors. All of them are offering seemingly solutions to all provider issues, but there's really no standard approach to for a practice to identify what the best software is for their organization. So obviously we're very, very pleased that EHNAC and WEDI took on this accreditation role with the support and endorsement from MGMA. With the EHNAC and WEDI, we've got proven entities. We've got a multi-stakeholder approach, which is critical. We have to have the support of the vendors, or this program simply will not succeed. And EHNAC, of course, has a wonderful track record of developing and implementing very, very successful accreditation programs in some other areas. Next slide, please. So the timing couldn't be better for the launch of this accreditation program. We've got, of course, the ACA Administrative Simplification standards and operating rules coming on board. We've got ICD-10 with a compliance date of next October. So again, it's going to require practices to either update or replace their practice management system. So a perfect opportunity to leverage that change and start really taking advantage of all the HIPAA and ACA opportunities, again, to automate the revenue cycle. We will be very, very aggressively marketing this accreditation process. We believe that when it comes time to selecting a product, this accreditation will, in fact, be the first question asked. And hopefully, if the answer is no, that vendor will not be on the short list to be selected by the practice. So I think it's absolutely critical that the industry get behind this, that the vendors support it, because I can guarantee you MGMA is going to really, really communicate this out and communicate that this must be the first question asked when looking to purchase new software. So with that, I will turn it back to you, Lee.
Bob, thanks very much. And again, I think the participation of MGMA plus a number of all the other provider organizations and associations that we've had involved has been absolutely critical in gaining your perspective and that of the providers as we've developed this program. I think has really looked to enhance and create the type of program that we're looking to do. So we really appreciate the promotion and your perspective here. So next we have Anna Croxton from NextGen. And Anna has been very actively involved all the way through this program as a HATA member and as a beta. And NextGen's involvement and feedback into the process has been very important as we've continued, and we are continuing to incorporate their perspectives, their feedback into this program. So Anna, let me turn this over to you.
Thanks very much, Lee. Well, go to the next slide. You know, we felt that it was hugely important that as a vendor that represents upwards of 80,000 providers, that we be part of a program that ensured for those providers that specific standards are met. And the way we did that is by participating as a beta, but incidental to that, you know, you had to start somewhere. So as a HATA member, it really gave us the opportunity to provide some input and reality check into the process. And then also as an advisory board member, which provided an additional level of input and comment, and maybe allowed me to become a little schizophrenic too, because sometimes I didn't know which hat I had on. No pun intended there. And then as a member of the HATA board, it was very critical to me that we represent a reality for a PM vendor into this process and ensure that the requirements were both reasonable and responsive to the concerns of the clients, both the providers and ultimately to their patients. Next slide, please. So, you know, we have faced some challenges. There is a lot of documentation that you may or may not have in one place, and certainly for a company of our size, it's not in one place. However, this did provide the opportunity to consolidate some of that information, which will actually be used for other programs as well. So the timing is right to kind of get our ducks in a row and pull this information together. It's important and it's critical, I think, as we move forward in kind of, especially with privacy and security concerns, that we do have our house in order. As a beta, we did have input into what is being required, and we had a few lengthy debates over the components that strengthens the intent of the program versus what might be construed as dictating how we do business, because that is not the intent. The intent is to secure for providers, again, that certain specific standards are met. And we do see accreditation as the new normal, that now moving forward, that the first question on an RFI or an RFP will be, you know, are you accredited? You know, it's been a privilege and a lot of fun working with EHNAC and the other folks on this panel. It's been an opportunity to strengthen what we feel is kind of the seal of approval for providers so that they know what to expect. And as a vendor, we recognize the importance of that in our industry. So thanks very much. Lee, I'll turn it back to you.
Thanks, Anna. And tremendous perspective and the involvement of NextGen as well as our other two beta organizations as well participating has been terrific in getting that perspective and continuing to enhance the overall program. So next we have Ron Moser, who has been involved as the senior site reviewer for EHNAC, and Ron has facilitated the development of the program with having ongoing meetings with the advisory committee, and we had a separate work group of the practice management system PMS vendors and participants who have been working to develop the additional criteria needed for the program that Ron has also facilitated. So I felt that it would be great to have Ron talking about the composition of the committees and the various committees and kind of some of the timeline that we've used and the process that we've done to go through this, and then as well to give you a perspective of what's involved and what you need to do to as well apply if as a practice management system vendor. So Ron, let me turn it over to you.
Great, thank you, Lee. You can move it to the next slide here. You'll see the leadership we had with this project. Again, Lee heading up EHNAC and Devin WEDI, of course. And within the management of this project, Mark McLaughlin worked with me in holding the various meetings that we'll talk some more about on a future slide, and just coordinating a whole lot of information. We had excellent participation, and Stanley provided excellent work as well as a consultant and really as a subject matter expert who really brought a lot to the table to help us in coordinating this whole process. So move to the next slide. The committees we had together, we had an advisory committee that started, I believe, around June, and I'll go over some of the composition of these groups on a future slide, but we had an excellent group together, including the people on this panel that really provided oversight for the work that was going on, reviewing the materials, providing feedback, and we met twice each month. The work group itself dug further into the details on really hashing through some of the questions and concerns. As Anna mentioned, what should be there in terms of a requirement versus, you know, are we pushing the vendors too far in having that requirement in there? And we really tried to make sure that we are truly requiring all the regulatory requirements, and in some cases perhaps having some best practices criteria. But as far as any criteria that are absolutely mandatory, we'll want to make sure those lined up with what really practice management vendors are required to have in place to begin with. So this was a great group, and they met on a weekly basis and really, again, did a lot of work in putting all this information together. And then, of course, we had the beta candidates, and we have 3 beta candidates that have participated. We held separate meetings with them as well and have been gathering feedback as they go through firsthand the process, and are really able to give some hands-on feedback to the whole process. So the next slide. The next slide shows the participation we had. Again, industry associations and organizations. I won't read through each of these, but you can see them here. Again, several of them represented on the panel today. But it was excellent to get the participation of these leading associations and organizations in putting this program together. I was really glad to be able to work with each of the representatives, and we had a lot of excellent progress. So next slide. The target of our accreditation, EHNAC has accreditations for various organizations, and we just have a few programs that are actually for products, and this is one of them that is actually targeting a product. So our practice management system is, of course, software, and that can be delivered in a host-based system or in software that's delivered to an organization. So it's really focused on accrediting a product that it meets the various requirements, but this program does include both organization and product components. And you might say, well, if it's for a product, why does the organization also have requirements against it? Well, that has to do with the fact that organizations that deliver these products have responsibility for the protected health information that is related to those products through customer support. If it's a hosted solution, obviously they're housing that PHI on systems that they control. But even in a software only, where it's all delivered on site through the various customer support, implementation, and other services provided, they have a high responsibility for safeguarding that PHI. Next slide. Some other targets of the accreditation, just to describe this, I think I mentioned earlier, there are 2 types of practice management systems that we address. One is host-based, whether you call it a SaaS or client server or whatever type of host-based service you provide with your software, and then the software being provided at a customer site. And then, so there are some organizations that provide both, and then there are some organizations that only provide their software in an installation model where they do not host it. And the criteria addresses both types of organizations. All of the criteria apply to the hosted service vendors. There are a few criteria that don't apply if the software is only installed on site. But again, most of the criteria covers both, but they're designated to show which applies to which. The designations that apply only to a host-based PMS system have HS in front of them. Next slide. The key areas of focus of the program, again, core, what we will sometimes refer to as our core EHNAC criteria. This is criteria that goes across all of our programs, and that, of course, has to do with HIPAA compliance through privacy and security requirements that cover HITECH and Omnibus, and also through certain environment, technical performance, business practices, and physical and human resources. There are some core criteria that we always look for to make sure an organization can truly deliver what they say they can deliver, that they measure how they deliver those services, and that they have the resources required to provide those services on an ongoing basis. And then specific to practice management systems, we have criteria around transaction and coding standards, software development lifecycle, overall software requirements, and then the full revenue cycle management, again covering the full range of transactions and supporting services that a practice management system needs to be able to handle. So again, I'd like to reiterate what Lee has said as well. We really appreciate the incredible involvement we had. As you can see, we had many, many meetings. We had excellent representation, and especially the people on this panel really stepped up to the plate, provided a lot of input, and helped us to build a program that is now, by the end of today, or actually I should say within about a week, we'll be putting it out, I believe, for public review. So you'll be able to see the criteria within this program and provide your own comments on it. So Lee, I'll turn it back to you.
Thank you, Ron. Great overview. So as Ron was indicating, I just wanted to spend a couple of minutes to talk about the time frame that we are, in fact, developing this program and looking to launch it within. As well, I did want to recognize the three organizations, the three beta organizations. You've heard from Anna Croxton from NextGen. We've also had GE Healthcare, along with HealthPack Computer Systems, are the three vendors that have been involved with us as betas, and I wanted to recognize their involvement and really appreciate the input and the fact that they really were willing to take a risk and work with us to develop the program. As far as the timeline is concerned, as Ron indicated, we really started this program starting having first meetings in June. It took probably about a couple of months to actually get all of the participants lined up and committed to participating. We started our first meetings in June. We have been meeting, we've had multiple meetings through, in fact, today, in which we have the final draft of the Practice Management System Accreditation Program, or what we're referring to as PMSAP. The intent is to gain approval from the advisory committee this afternoon to move this to EHNAC, to the criteria committee, as well as to the EHNAC Commission Board for their approval to send this out for the 60-day public comment process. What EHNAC follows is very much the ANSI process for standards development organizations. So it's a very transparent process. So this will go out for 60-day public comment, so the entire industry will be able to review and provide comments back to us during that process. We will then take those comments. We will incorporate them review them and incorporate them into a final version of the program, which we will be looking to finalize by the end of January 2015. We will start at the beginning of November. We're actually going to be launching the program at the WEDI conference in about 2 weeks, and we will then be opening up the process to take applications from practice management system vendors, as I said, at the beginning of November, and those organizations will have the then current version of the draft of the Practice Management System Accreditation Program that they can use, and they will be required, however, when they submit their self-assessments to EHNAC, they will need to be compliant with the final version, or version 1.0, that will be released at the end of January. But they'll certainly be able to start the process and have the majority of the criteria already in place that they can be working with. So organizations can therefore get a jump, certainly a 60 to 90-day jump on the process by starting and putting in their application early in November when that is available. So that's the timeline. I think the thing that's going to be important for that is a lot of organizations, a lot of the, certainly the vendors are going to want to go through early in an effort to demonstrate and to get their accreditation, to demonstrate their ICD-10 readiness as well as all the other aspects that are incorporated in the program. So all of the entire program, you'll be able to see the entire program. We'll be going out with a press release in about 2 weeks announcing the fact that we have the 60-day public comment processes in place, and you'll be able to download the entire program, this current draft, from the EHNAC website and be looking at it and providing comments back to us. So that's the timeline that we're going to be operating with. So the next part of the webinar is we're going to be going into some panel Q&A. What I would also tell you at this point is if any of you have questions, you can start submitting those questions to us and typing them in and submitting them, and we'll get them queued up so that after I'm asking the panel some additional clarifying questions, we'll go right to all of yours as well and try to give you as much information as possible. So first question I've got, Rob, kind of going back to MGMA's overview and their involvement with the program. So what kind of role will MGMA continue to play basically in the promotion of the overall end product, the PMSAP end product? And do you see kind of an accreditation role, playing a role for the physician practices in the future, especially as we're continuing to get other governmental mandates evolving and needing to be implemented over the foreseeable future here?
Yeah, Lee, great question. And obviously, one of the things that we do as a trade association is both educate our members, but also give them a forum for interacting, networking with their colleagues. So I think this is going to be a very important topic on our online communities, at our annual conference. So it's a wonderful opportunity for the word to spread mouth to mouth, because I think once the accreditation program goes live, I expect there to be a very, very solid uptake from the vendor community. I think we saw that earlier with CCHIT and their EHR certification process that launched in the mid-2000s. There was some initial uncertainty with the program, but very quickly the vendors got on board, and it became, again, the benchmark for product selection. What's wonderful about this PM accreditation program is that it opens the door for future phases of the accreditation to fold in any new government mandates. And if there's anything that's certain, it's that we will be seeing additional mandates going forward. But it can also leverage some very interesting changes in healthcare. For example, there's some efforts underway to standardize patient identification and use of smart technology, for example, to incorporate into the ID cards that patients bring to practices and hospitals. So that's the type of thing that could easily be incorporated into future iterations of this program. So again, it not only provides a benchmark today, but it can also be used in the future as the government and industry, quite frankly, come up with new solutions to better the delivery of healthcare.
Yeah, that's a terrific perspective, Rob. Thanks very much. Tim, as we've talked, as you went through HATA and the involvement and HATA's role here in representing the practice management system vendors, you've gone through kind of an evolution and are continuing to, I know, promote active participation by the members that you've got. I guess the question I've got from a HATA perspective, I know that you've been actively involved here. We've had several of other organizations. From a HATA perspective, I know that HATA is very supportive. How are the other practice management system vendors? How did you include your membership in the development of the program and making sure that they had a voice in the development of the program as we've been going through this timeline?
That's a great question, Lee, and we certainly have been involved, and I appreciate the opportunity for that. As I had mentioned before, we had HATA folks look at the core criteria. So what would happen is we had a number of our member organizations, so the ones that you had listed earlier on that right-hand side of all those folks that were involved. And we, being on the core criteria committee myself and Anna and Stanley, as a matter of fact, we would take back from the work group meetings that Ron was discussing, and we would look at the criteria on a weekly basis with the HATA members and go through each and every point and make comments that then I would take back to the work group, and we would discuss it with the work group and work through those. So at all stages of the core criteria, we were involved, and we did the same with the instructional guidance that goes along with the core criteria. So as Anna was saying, we wanted to make it value to the practice management systems by asking information on information that is important when making the decision about accreditation and choosing a practice management system.
Great. Thanks very much, Tim. Let me also say to the audience here, if you have any questions, please submit the questions, and we'll be queuing those up and getting to your questions in a few minutes. Ron, I've got another follow-up question for you. The overview that you provided was excellent. I think a question that people would have that are thinking about going through this is basically a couple things. First of all, if an organization goes through the accreditation process, one, do they have to go through accreditation again after each new release or sub-release? Because I know what people need to understand is that even though this program will be developed in version 1.0 by the end of January, each of the programs goes through at least an annual release of additional criteria and enhancements. So it's an ongoing process, an ongoing evolution as each of these programs continues to evolve. So the question is, how often do people have to go through a reaccreditation is one, and what organizational sites are you looking to actually physically review as far as the site review side of this, and how long do those reviews last?
Okay, thanks, Lee. First of all, regarding the versions of the program, I guess there's two different things, and that is, one is that EHNAC puts out a new version of each of their programs on at least an annual basis, and then there's the fact that we're accrediting software, and that software obviously will have multiple versions go out. EHNAC conducts its accreditations on a once every 2-year process. So a given software product will be accredited, and once it's accredited, it will not have to be reviewed again for 2 years. Now, we did have some discussion within our work group and advisory committee on, just how significant of a change could there be to a given product without them having to have it re-reviewed, and we'll probably continue to study that issue. But at this point in time, it's a once every 2 years for a given product, and we really didn't see a need to have to go any more granular than that. We're certainly not going to be overseeing every minor release that goes out, or even for that matter, at this point, we don't plan to look at major releases. It's a once every 2 year process. In terms of on-site reviews, that is part of EHNAC's methodology for doing accreditations, is to have on-site reviews where we both look at the physical locations that house the PHI, and we have interviews with the organizations that put the software together. We found this to be extremely effective, and there are things that you just cannot get from documentation submitted that you get out of on-site face-to-face meetings. So there will be at least an on-site meeting with the organization that's produced the software, and then if PHI is located at a separate location, such as if you provide a SaaS-based product that's delivered out of a third-party data center, that data center would need to be reviewed as well for physical security and to talk with the management of that facility, unless it's an organization that EHNAC has already viewed within the 2 year cycle.
Excellent. Thanks, Ron. Anna, as you've talked about, NextGen's involvement as a beta, and some of the process that you went through as far as the rationale for participating, I have a question for you. So what is for the practice management system vendors that are listening to this webinar, what advice would you give them on what they need to do to go through the accreditation process, and any other advice as you and your team are going through this and putting together the documentation and the additional evidence necessary to respond to all of the criteria? What advice would you give to others to, one, prepare, be thinking about right now if they're going to be applying in early November, and two, what should they, how should they be looking to organize themselves in going through this type of accreditation?
Sure. Well, definitely assign a project manager. I think that is probably the single most critical element. There's a lot of consolidation of paperwork and a lot of herding cats, if you will, because depending on the size of your organization, you're going to have to go to multiple people to get responses and then follow up with those people. So a project manager, I think, is really critical to the success, and acknowledge that it is very time-consuming. So if that project manager has other responsibilities, factor that in and free up some time so that this can be the focus of that effort. We learned that the hard way. Start gathering documentation pertaining to privacy and security policies. If it's not all in one place, start gathering it and put it in one place. Believe me, you're going to need it for other things as well. So gathering and organizing that information, you can do that now, and it would be probably in your best interest as a business to do that now. And then also think about participating in HATA. That will ensure additional input as we move forward and as the accreditation morphs, as technology changes and different functionality is required. I think, there's one thing to pass the accreditation, and then it's another thing to think about the future and how things might change and how you can impact that change.
Excellent. Thanks. Thanks, Anna. I think that that's very good advice for the practice management system vendors that are looking at this and wanting to go through the accreditation. Stanley, we talked about the value prop really here to the providers as well as to the practice management system vendors. And one particular stakeholder we haven't talked as much about is the payer value proposition as well. We hope we have a number of payers, I'm sure, that are listening to this webinar. So what kinds of thoughts would you give to the payer side, Stanley, as far as the value proposition there is from your experience working not only at CMS, but a lot of the consulting that you're doing in the industry?
Thanks, Lee. It's an excellent question because the payer community is a significant block in our significant part of the administrative side of our business. Where I see this benefiting health plans is by giving them the knowledge that the providers that have an accredited product will be able to produce the standard transactions in a timely and efficient manner. They won't have to do the necessary sort of hand-holding and work in massaging transactions to get them to the right format and content. You can see them cutting down on their questions to their help desks. And also they can see that their providers will be taking advantage of all of the electronic transactions. And one of the things that is a significant burden on health plans is the calls from providers on questions on eligibility or claim status, or even questions about a particular remittance advice. By using a product that meets the accreditation criteria, providers will be able to do those functions electronically rather than using phones or fax machines. So health plans won't have to support that much customer service and can, take that staff and focus them on improving health plan programs and building out their electronic transactions as opposed to dealing in the phone. I see another potential that health plans will have by either giving bonuses or suggesting that their participating providers use these accredited practice management systems, again enabling the health plans to take advantage of that and encouraging the providers again to use the effective, the efficient, and the better accredited practice management systems.
That's great. Thank you, Stanley. Appreciate it. Appreciate the perspective because I think it's obviously on the provider side of this is going to be important as well to be understanding the value proposal to them and to really their network, their provider networks. So, Dave, do we have any questions as yet from audience that we can address?
We do, Lee. We have a couple questions concerning price.
Okay.
What costs will be associated with accreditation, and how long from application to approval will it take to get accredited?
Okay, so let me address both of those. First of all, on the pricing side of the equation here, for a smaller entity, we have all of our pricing is on the EHNAC website. If you go to www.ehnac.org and under the pricing or fees, the entire fee schedule is there, and it's based upon revenue of the organization. So it starts from anything under $3 million in revenue to over $75 million in revenue. So, and what that provides is there is an annual fee that organizations pay based upon the size of the organization, and there is as well a site visit fee that is part of that as well. So for organizations, you can see you'll be able to go on to that and take a look and see what the fees are. But again, it's the intent is to make it very easy for organizations and not an obstacle for organizations to go through it. So just as an example, if an organization is very small and under $3 million, the annual fee is $2,750, and then the site visit fee is $3,750. So for each of the sites that necessarily need to be visited, then that site visit fee applies. So again, for less than 7,000 for an organization who has only one site to visit, and under that very small category, that would be the cost. So, and then it goes up from there. There are 6 different tiers that we have for organizations. Again, it's by revenue amount, and again, as I indicated, under $3 million all the way up to greater than $75 million. So the intent is for smaller organizations, for larger organizations, for this not to be an impediment or an obstacle for organizations going through. I think your other question was the timeline, Dave, is that correct, to go through it?
That's right.
So the timeline to go through, organizations have, so here's the process. From the time an organization goes through and applies and goes through the application process and is approved as a candidate, the organization then has up to a year to go through the accreditation process. The self-assessment component of the process, an organization has up to a maximum of 8 months to complete, which will allow then the additional time to schedule for the site visits for the remaining, any time during that remaining 4 months, but the process has to be completed within a year. Now, that's the maximum. Organizations, and we get questions all the time saying, well, how short a time would it take for an organization to go through? So organizations can actually go through. We've had organizations that have gone through some of our other accreditation programs in as little as 3 to 4 months. And organizations can do that if they have the documentation, and I think as Anna provided some very good perspective and puts together and assigns a project manager, that they can certainly, and the project teams, they can go through and do this even much faster than that. So that's the maximum amount of time, is up to a year to go through the accreditation process, but organizations can go through this in as little time as they have the organizational structure to put together the documentation as part of the self-assessment, and then for the site reviews to be scheduled with one of our site reviewers. I can only as well add that going through the process, this is not just a checklist of going through. It's a very consultative approach that the accreditation process goes through, and the intent is to assist organizations to achieve the accreditation and to provide additional recommendations to your organizations so that you can continue to provide and be positioned for further growth. We make a number of recommendations as we're going through and as we look at physical security of organizations as well, of data centers, etc. We always are providing a number of additional recommendations to assist organizations to enhance their overall, not only their processes and their policies, but also how they're able to respond to the questions as they're coming in, as far as in the call centers or other areas that are providing additional services to providers. So that's the answer, I think, to that question. Ron, would you have anything else to add there?
No, I think you covered it really well, Lee. The 8 months for getting the self-assessment in and 1 year for completing accreditation, I think, are kind of the key milestones.
Okay, great. But again, as far as the fees, please, you can go onto the EHNAC.org site under fees, and you'll see all of the 6 categories there based upon revenue. All right. Any questions?
Lee, yes, one more that just came in. Can PMSAP and HNAP EHN accreditations be combined, since much of the criteria will be the same?
They are different. They are different programs. We have specifically taken and we've created and developed with the practice management system vendors and all the stakeholders that have been involved in developing the program, specific PMS vendor criteria as part of this program. And, for example, we've talked about ICD-10 readiness, and there are other aspects that are specific to the practice management system vendors that we have developed here. So the answer is they are different. There are a number, as Ron was talking about, we have a number of areas which are, quote, kind of our core criteria that are the same or similar from within each of the programs. And certainly, if an organization has gone through our Healthcare Network Accreditation Program, HNAP, EHN, Electronic Healthcare Networks for clearinghouses, a lot of that criteria is similar, and certainly they can leverage a lot of the answers if they've already gone through it. They can leverage a lot of the documentation that they've previously provided for this. But there are a number of criteria that are very specific to the program that they would have to go through and answer. Now, we do, for an organization that already is accredited through HNAP, EHN, or any of our other programs and wants to go through this, we do have a multiple program fee, which will make the cost for an organization to go through the additional accreditation much less. So, and that's as well on our website under our fee categories for all programs. And so if an organization wants to look at that, they can see what they need to do. But it is different. It's very specific. But a lot of what an organization has previously gone through to be accredited will be able to be leveraged for those that are those criteria that are the same, Dave. Good question.
And I'll just, Lee, if I can add to that, we can, for companies that want to go through multiple accreditation programs, we can help them in mapping between the multiple programs as well, so they can see which criteria are the same.
Very good. Very good. Thanks, Ron. All right, good. Any other questions, Dave?
That's it from the attendees.
Okay. So I've got another question. Anna, as NextGen has been going through this, and we've got obviously GE and HealthPAC as well going through, and other HATA members hopefully will be considering going through the process. Is there any other advice that you would be providing to them right now? I think you've given some really good thoughts on what organizations need to do. As far as the process and kind of lessons learned that you've been going through, how I guess how has the process been so far for you as you've gone through it? Are there any additional lessons learned that you've gone through so far? And I know that you still have got some time before you'll complete the overall process, but any other thoughts you would give to people as you've been going through this with your team?
Sure. While it's been a lot of fun simply with the interaction with a lot of the folks, it has been a struggle, and part of it due to our size and the disparate systems and departments that I have to interact with in order to gather some of this information. So tracking down the required documentation has been a challenge. On the flip side, it is a good exercise for us as an organization because it does force us, to centralize and share that information that's going to need to be readily available for other purposes. For instance, ONC ONC is going to require they're going to start, ACOs will conduct audits on business associates, such as EMR vendors, which we are, no, it's not as a PM vendor, but as an EMR vendor. So we have to gather all that privacy and security information anyway, for other purposes, so might as well just do it now. We do think it's really going to be, hopefully, a competitive advantage, and that the work and the effort that we're going through right now will ultimately be worthwhile. But I think the biggest thing is, as a provider, many of us have been in this industry for a really long time and have worn many hats. If I were a provider, I would want to know that there is some governing body that says certain criteria will have been met. by virtue of that accreditation. And I hope we as an industry can do a good job of providing that kind of security and sensibility for those providers, because it is a complex world. And, you don't know what you don't know, and many times they simply don't know to ask certain things that could very dramatically affect them. So, my hope is that we do a good job in giving them that kind of assurance and do it responsibly.
That's great. Thanks. I think the other thing, another point I wanted to make to the audience is the fact that once an organization goes through and is accredited, what we do, a couple of things that the organization, I think you'll want to know, is that all accredited organizations are listed on our website. So in fact, we had a number of state as well as federal agencies that are constantly monitoring our website to see who is accredited, who is a candidate in the process. So even if you're a candidate, we've got a lot of organizations that are checking on an ongoing basis to see who is going through the process. So that is a very important recognition. Second, what organizations also receive when you are accredited, you get a letter from EHNAC stating your accreditation, plus we have a couple of different awards that are sent out and provided to our accredited organizations for you to display. So any organization that's asking your status, whether you're accredited or not, you can either show them your accreditation. A lot of people use, a lot of vendors use it at conferences and other types of forums and venues, as well as the whole aspect that a lot of organizations refer people and providers, others, to their website on status, which is also very important. Lastly, as EHNAC is a not-for-profit organization, it's, as I indicated, we're all about trying to work with organizations to help them achieve accreditation. So the partnership that we have with WEDI, and as I indicated, we're going to be launching formal launch of the overall program at the WEDI conference in about 2 weeks in Reston, Virginia. WEDI as a partner has been terrific, and so as far as the promotion, so we will be working with all of the organizations, WEDI and others, to promote the program. We will as well, for all of our programs, have all the criteria for those programs on our website for organizations to download. So the intent is to make all of the criteria available to organizations to download and see exactly what they need to do. And as I indicated, we'll be going through the 60-day public comment period that will be starting in the next 2 weeks here. So the only other thing, the other question I had, Ron, for you that people may be asking is, you talk about ICD readiness, which is incorporated in this program. What types of criteria, Ron? Can you give people kind of a general idea of the types of criteria that will be asked as part of the self-assessment package for ICD-10 readiness?
I can address this a little, and I probably won't bring the details of it to mind as well as someone like Stanley, but we have some criteria that specifically require the readiness. We expect to be able to see documentation, screenshots, and testing results of the readiness for both for ICD-10 as well as, of course, the demonstration that you do ICD-9 correctly, and that you're working with your customers on meeting all of the timelines and the requirements. Stanley, I don't know if you have any further input on that.
Ron, you covered 99% of it. I think it's important that we recognize that ICD-10 will not be required until October 1st, 2015. So the review will assure that the practice management system will continue to support and can support ICD-9 appropriately until that date, and that ICD-10 can be used in the test transaction mode, and what the plans for the implementation will be to assure that the system does meet the requirements, again, according to the regulatory timeline. And that's an important consideration that we'll continue to keep in mind as new requirements creep up, as Rob Tennant was talking about. We would not expect instantaneous implementation of those new requirements by practice management systems until somewhat closer to the regulatory deadline, and we'll be looking for those sort of implementation plans and test plans from those vendors to show us that they're working towards the appropriate implementation.
Thank you. That's great. Thanks, Ron. As well, you know, we've focused. This program is focused on the practice management system vendors. Do you want to talk about the fact that or answer the question, are EHRs also included with this program as well?
We had several discussions around that as well. Really, as far as this program goes, we want to know that you can interact appropriately with EHR systems, but we do not get into the specifics of EHR accreditation or certification, since that's covered elsewhere through EHR certification. But we just need to know that it can be supported appropriately, but we do not, it's really excluded. The scope of EHR accreditation or certification is really out of scope for this.
Great. Thank you very much. So I think the only other question is, would we have any other questions from the audience, Dave?
Nope. The last one, Lee, was just on the recording itself. So I just wanted to let everyone know that the full recording of this voice and the slides themselves will be posted on EHNAC.org. We'll get to that as soon as we can. And we'll also try to send these out directly to the attendees to links to that site.
And we'll also have the presentation as well in the next couple of days. Will also be available not only on the EHNAC site, but I'm sure that on WEDI and others will also have both the audio and the presentation portion will also be available, and perhaps even on some of the others on the panel will also have it available. I'm sure that MGMA and perhaps some others will make it available to all their members. So I have one other last question for the panel, and is there any last-minute advice, guidance that you would provide to any of the people that are listening, as far as our audience here, as far as words of advice going forward, as to what they need to do, the importance of the program, any more on value prop as far as that we didn't cover? So let me start, Tim, with you. Any other thoughts here?
Lee, I just had one thing. You know, we're going to be releasing the core criteria in a 60-day public review period, and I just encourage everybody to look at it, make comments as appropriate. You know, sometimes we can't see the forest through the trees, and we've been working on this for so long that maybe there's something we forgot or didn't get right. So we encourage folks to look during the public comment period.
Great point, Tim. Thanks. Ron, any other items that you had?
Not other than just, again, thanking everyone for participating, those who were involved in the work group and the advisory group. They really did a lot of work here.
Terrific. Anna, any other last points?
No, just want to thank everyone, and for those vendors that are considering participating, I have to say that be brave, move forward. We're not asking for the secret sauce. We're asking just to provide some reasonableness and reliability to the provider community.
Great. Devin, any additional thoughts?
Oh, you know, I think most of it's been said. Maybe go ahead, pick up the phone, make the call, and start, you know, getting lined up your interest, because I think this has a huge potential to really transform our industry, and we appreciate everybody's attention to the program.
Terrific. Stanley.
Just that we talked about the benefit for plans and for providers and the assurance that providers have that they're getting quality product. I think vendors also get the assurance that looking at all the criteria and the review that we're doing, it'll assure them that they are appropriately meeting the needs of their customers, and that they haven't missed anything in terms of regulatory and other types of business requirements. So it's a clear benefit to the vendor to go through this process.
Thanks, Stanley. So let me take the opportunity to thank the panel again, Devin Jopp, Rob Tennant, McMullen, Stanley Nachimson, Anna Croxton, and Ron Moser. I very much appreciated all of your participation on the panel, and thank all of you, the audience, for also participating. We look forward to your comments as we go out for the 60-day public comment, and we also look forward to all of you who are practice management system vendors to hopefully be applying and putting an application early in November when the program is launched nationally. Thanks again, everybody, and have a great rest of the week. Thanks.
Bye-bye.